Hello, all, and welcome to the Digital Health and Wearables series. Actually, I'm extremely excited. It's our big launch today with a fantastic guest. Before we go ahead, I'd like to acknowledge our global partners, Spirit Digital, and our supporters. So please check them out. And without further ado, I'm gonna introduce the very first guest. John Nosta is an innovation theorist and the top health tech influencer. So, John, welcome. How are you?
Thank you. Thank you. I'm terrific. Congratulations on launching your new endeavor. And I just want to take a moment to thank you for the work that you do. It's not easy keeping track of all the innovations in the context of wearables and digital health. And I always look to your social media feeds, to Twitter, to really find out what's going on in the world. So thank you for making us smarter and making us better in the context of digital health.
John, I appreciate the kind comments. You know, I'm also a big fan and I follow all your stuff. And actually, we know each other for quite some time.
Yeah.
But I feel like last year we supposed to meet in Berlin, in Germany. It didn't happen for one reason or another, but here we are, extremely delighted to connect. And we both very active in digital health. My first question, John, for us to discuss a little wider is perhaps like a global landscape in digital health. How do you see the state of digital health right now? Give us some insights.
Well, I think that we are finding out new things about digital health. So, and this changes day to day, week to week, month to month, because 2020 has been such a crazy year. The first thing, there seems to be this fundamental sort of triple inflection point that I talk about a lot, that we're seeing three interesting things happen at once. The first is this idea of technological availability. We have amazing technology in place now. We don't have to invent it. It's there. It's not innovation, but implementation. So that's the first part of this inflection curve. The second part is the changes around government and regulatory bodies looking at digital health as a real partner. In other words, they're giving us the green light to use some of these technologies. Of course, this is in part driven by COVID. But the third is much more of an esoteric or ethereal concept. And that is, it's the right thing to do. There's a moral imperative around leveraging technology, whether that technology is, let's say a mRNA vaccine for COVID, or it's an app on your phone to help with some of the more mundane aspects of, let's say, tracking and tracing. So for me, we're seeing this sort of triple inflection point that is looming at us. Now, that's the first half of the story. That's the first half of the story as of yesterday. But I'm still thinking, I'm looking at the data, and if you look at use, if you look at telemedicine, which is a real interesting barometer of digital health, what did we see in April? It went up, right? It went up a lot, several thousand %. And everyone said, the era of digital health has arrived, right? Everyone said digital health and telemedicine has arrived. But what we're seeing is that's falling dramatically, almost back to baseline. So what the heck do you make of that now? So that's where one of the issues for me is that it seems almost paradoxical, because I think that people want a return to normal, not an advancement in technology. In other words, they just want to go out to dinner and sit in a restaurant and have a bottle of wine and have dinner with their friends, as opposed to using their new electronic gizmo to cook their dinner at home. So things are changing, and I think we're seeing a combination of technological advance and human nature. So that's that interesting duality, that paradoxical duality that I'm seeing in digital health. I think it's simple to say that the toothpaste is out of the tube. That's clear. It's here. But I think we're going to see that curve. We all talk about, how many times have you mentioned the exponential curve? I don't think the exponential curve is smooth. I think it's a bit more like a roller coaster. It's going to be more ups and downs because there's so many factors involved in digital health right now.
John, thank you. That is fascinating. I do agree with you that we are ready for implementation right here, right now. And also, your insight is very apt to the here and now. I mean, I do agree with you. It feels like we are accelerating, but we feels like we also resetting back
Mm.
to square one, back to initiating things as we were maybe 5 to 10 years ago. You know, when digital health, and you've been in the space for a long time, when digital health started to get some momentum, it feels like we are moving very fast. It's a funny feeling, but also feels like we need to go back to basics and do it well and start it again. So it's a funny paradox there. I do agree with you. And how do you see healthcare innovation as a whole? What are the main challenges and barriers in your perspective? Because it's so much to consider. I mean, of course, implementation, readiness of government systems, the technology is ready, but the structures are not, and the people are not adopting them. So it's so much to consider. How would you comment on that? What are the main barriers for you?
Well, I'm going to go back to telemedicine a little bit because I think that's a very interesting area, because it's so much on the forefront. It's become a mainstream modality. And I was speaking to some physicians, the former head of a large telemedicine organization, and he said something striking. He said, if I ask a patient to do a telemedicine visit, they usually shake their head and they're rather excited about it. It's the physician that is more reluctant to initiate the telemedicine visit. So I think that there are many, many factors, but I do believe that we have to look at our clinicians and the nature of medicine today. You know, medicine is an oppressive system. We have the hierarchy, the clinical hierarchy, so many aspects of medicine. And that's a good thing because we have people's lives in the balance. So it's not trivial to have hierarchy. It's important. But with that hierarchy comes the safety and the protective nature and the quality of care. But with that comes this reluctance to change. And we see this all the time. Look, a physician wants a new antibiotic. What do they want? They want a cephalosporin with an expanded safety profile or an expanded spectrum of activity. In other words, they want the same but better. That really is in many instances the nature of most of medicine. Those aren't the early adopters I'm talking about. So what we're seeing here is a return to the inertia of practice. So I think that we have to take a good hard look at what are the driving forces around clinical change. And I don't want to just point my finger at the physician and say that he or she is the problem. It's in the United States, it's a reimbursement dynamic. It's availability. It's how does technology accommodate into practice? So I have a physician who's used to going into that office and used to using certain tools. All of a sudden, I want her to use an echo stethoscope. Oh, come on. You know, it doesn't fit into clinical practice. So I think that is the area that I'm going to be focusing on 2021, because I believe that, interestingly, patients desire change, and it's the clinical hierarchy. And that's payers, that's doctors, that's technicians, that's the infrastructure itself is a big area that to me is impediment. Now, here's the other one. I'll go through it quickly because I think that it's another one of these psychodynamics. You know, it's like the psychology of medicine, right? It's someone is very proud to say, I'm a doctor, you know? And that's good because doctors are often regarded as, and I put this in quotes, the smartest person in the room. So when a nurse is in the room, in a hospital room, or a respiratory therapist is in the room and the physician walks in, everyone stands a little taller, you know? They pay attention because the doctor's in the room. Well, I think that in 2021 and moving forward, you know who the smartest person in the room is going to be? The computer.
Wow.
Wow. Right. Exactly. Wow. That's That's exactly the point, because the computer is basically smarter than a clinician. I mean, that's the reality of it. So what that does, it's going to shift the cognitive burden away from the physician. So that's frightening. That's scary. But what we will see is the emergence of a partnership. And let me come full circle on this. Let's go back 5 years, 10 years ago. We talked about this whole notion of engagement, right? We have multiple stakeholders and everyone is engaged. We often talked about it in the context of patient centricity, right? The patient should be involved. The nurse should be involved. The mom, the dad, they all should be involved. Well, who is the new participant in this collaborative dynamic? It's technology. And technology may open the door for physicians to do something that they've been complaining about for a long time: spend more time with the patient. So I think it's going to be a really interesting time. I'm going to focus on the nature of how technology adapts or works with clinical practice, because I think that's going to be a very, very important area to drive that change forward.
Yeah, sure. That is fascinating. Also, is so much in there to consider, John. That, I mean, is the culture, I mean, is the human nature resistant to change? Is the healthcare systems? And now both me and you work internationally, and every country is different. They prepared in different stages. I'll give you an example, not a criticism whatsoever, by the national health system in UK, the NHS, very famous internationally. Also, fantastic work, very good reputation, free of charge. But for example, in terms we talk about implementation, we're talking about technology and health systems. All hospitals in different countries have different technologies from different providers. They don't communicate with each other. It's a massive headache in terms of not getting the data. If I'm in the southeast of England, if I go to Manchester, they're not having my medical records. So anyway, it's not the criticism, but it's frightening, because we talked about the availability. Technology is available, actually very, very mature, and these things are not in place. And every healthcare system is different, isn't it? If we go to Germany, now they're doing major milestones ahead of everybody else. If you go to the Netherlands, very sophisticated in digitizing healthcare systems. But anyway, it's a lot of complexity. But I love the way you interpret and also bring out the technology aspect. But it's so much to consider, isn't it?
So here's the interesting point, is that if I can come up with a diagnostic test to find cancer very early, or let's say I can come up with an immuno-oncology therapy that is off the shelf, that doesn't cost a lot of money, or I can come up with a pulse oximeter to measure, my blood oxygen levels. That clinical need is so high, it's so important that it will get adopted into the system. And for me, what I think we're seeing here is the I word, right? It's innovation versus implementation. Because, a lot of innovators, they're whispering in the dark. They know what they're doing, but no one else does. It doesn't fit into the hospital system. It's not communicated well into the hospital system. And we all know this is not a concept that is related to digital health necessarily. It's medicine. The awareness of Helicobacter pylori as a causative pathogen for ulcers. It took a while for clinicians to recognize that you don't treat ulcers with the old school drugs. You use triple therapy. You use an antibiotic. So the ability for people to change is part of the message. And that's what I study. That's what I focus on. It's the diffusion of innovation. And so many digital health innovators, and you've seen them, we make all sorts of wacky wearables and interesting ideas, and they believe that build it and they will come. Right? It's a great idea. It will automatically be adopted in medicine. And that's the duality that I see that is so important here. Innovation and implementation. Just because it's a good idea doesn't mean it's going to be accepted. So that's important. Many digital health innovators that I see spend all their time and all their attention on their widget, on their device. But then they don't know how to communicate that device, or they have a very, very naive perspective that, well, we'll just make the patients aware and the patients will drive adoption because that's the world we live in today. Well, that's wrong. That's wrong. If my pediatrician tells my wife not to use that digital thermometer, she's not using it. As much as what I see on Facebook and social media. So I think that the implementation is a very, very important aspect of the transformation that we'll see in digital medicine. I go back to telemedicine, right? The technology is here. We have to implement it. And the implementation, go back to the early days of the web. Remember, we used to have like an 8-page brochure, and we would translate that brochure to the web. Page 1 was the cover, page 2, page 3. But now we have a very rich user experience. We have adaptive technology where the web changes. It changes for whether I'm using a PC or a phone, or it designs the page around my needs. It's called the user experience. Do we have that in telemedicine? Do we have a user experience? No, we have a Zoom call. We take a meeting and we push it to the computer, and we expect the physician to have the adequate diagnostic information, and we expect the patient to be comfortable with that dynamic. And that's wrong, right? That's not necessarily a function of technology, but a function of adapting technology. Now this is your area, so you know this so well. Think of all the tools we can add to that telemedicine visit. A portable stethoscope, an otoscope, things to hear breath sounds, temperature, EKG, blood pressure. All those things will reinvent the implementation, and it'll become telemedicine 2.0. And that might be the secret to getting over the hurdle of where we're moving, as we see this decline of telemedicine as less of a novelty. And let's face it, for some people, it's like, yeah, let's try telemedicine. It seems like it's fun. It's interesting. I can stay home, but it's not a clinical imperative. Imagine if we move to the point where the telemedicine visit is better than the office visit. And to me, I think that's going to be a function of telemedicine 2.0 and 3.0, where we're using all the tools and devices that you talk about so eloquently as we integrate them both into the lives of doctors and patients.
Yeah, sure, John. I really like that. My next point was actually, I could not miss that, actually leads really well to talk about wearable sensors, smart devices, new emerging technologies. All these all fit in around not just the patient, but around the implementation, around the barriers, around everything. Because one of the questions that always comes up, regardless of the great innovation that we have available from small and big players, big innovators now, is who's going to pay for the device if the health systems are also so overstretched?
Yeah.
But it's a funny dynamic, because we know that the device is going to make the transition and also the gathering of the insights and health more effective, and also is going to enable people to look after themselves in a better way. We have this funny dynamic, which is the financial, and then we have the human side, because we are human beings. As you know, I do a lot of work with wearables, and people engage in different ways or don't engage. The long-term engagement is an issue. So how do you see all these things fitting in with the technology, with the systems? There's so much technology and innovation available. It's actually scary not to maximize them, and not everybody is going to be successful. You know that there's hundreds and hundreds and thousands of innovators. Not everybody is going to be successful, regardless of having a great device and a great idea. How do you see this combination, this dynamic?
Well, it's the nature of innovation. I think that I want more, and I want a lot of voices, because I think that it's the eclectic nature of innovation that's going to drive the change. And we're moving to the point where I think we're looking more around outcomes. We're moving beyond the days of the EKG that you can take in your hands to the detection of atrial fibrillation. We're moving away from things like blood glucose measurements to a more broad perspective, like how do I optimize insulin? So continuous glucose monitoring is interesting, but it's only when it's applied to things like outcomes analysis. that it'll help drive. And that's because we have a fairly difficult or recalcitrant cost structure. So I think that it's a matrix, and it's going to be a crisscross of cost, efficacy, outcomes, patient demand, clinical utility. And that's where we are now. That is I guess you could use the word cacophony. It's like everybody screaming and yelling at once. And that's a problem. But I think that we will, it's almost the path you have to follow. So I'm very excited about the outcomes, about the emergence of new technology. And we're seeing it all over the place. It's everything from a little monitor that you can wear to the work by Dina Katabi at MIT, where she's using remote monitoring or contactless monitoring. So the monitor is in the other room and it's reading you through the wall. So it's doing a sleep study where you have no wires on your body. So you get to be cozy in the bed and not in this rat nest of wires, that sort of define sleep studies now. So I'm excited. I think it's going to be real interesting. And wearables and the data that's coming at us, I often call it the third window into humanity, because I think that it's that big and it's that important. Mm-hmm. First, there was the telescope, and that showed us that we're not the center of the universe, and Copernicus got in trouble, but it gave us a new worldview. And then we had a microscope, and we looked at these things called bacteria, and there's a whole world smaller that we don't even see. And I think that big data and its associated analytics, particularly AI, will be that next window that will allow us to see humanity. And it's not just in the context of healthcare and medicine. It's human evolution. It's extraordinarily big. And that's the promise of wearables. I've often said that the data trumps the device, that we'll actually see the emergence of data that is so rich, that is so interesting, that, as many have said, it becomes the new oil. And that's going to be exciting in the near future.
Oh, brilliant. John, I have a passion for wearables, and my big vision is that the wearables can change the world and have the potential to do great things. And now they're permeating many industries. Of course, healthcare is very, very prone to us, but they're permeating banking, construction, insurance. Many other industries. But I'd like to move on. I could not touch the COVID. It's a funny situation, but finally, my last point is about how do you see, and I've been following all your content, and you've been very active. Thank you for that, about bringing best practices, your own thinking, but also connecting all this situation and the medical side, but the human side. I like the way you interpret humanity, and the technology side is very important. How do you see digital health and the COVID-19 situation? Do you think the COVID-19 really highlighted the things that we should be doing in digital health? How do you see that funny dynamic?
Well, I think COVID is it, I don't know if it's a meteor or an asteroid, but the one that hit the earth and the dinosaurs went away, it marked a change. And we're seeing that today in so many instances. We're seeing the emergence of social strife, of disease, of Alzheimer's disease, of cognitive impairment. We're seeing political unrest. We're seeing social issues. We're also seeing technology emerge. And then all of a sudden, this thing called COVID came in and ignited the change. So, for me, what do we see about COVID? We see genetics, DNA. We're looking at the spike proteins. Look at the vaccine. I don't know why people aren't more amazed at the vaccine. 7 months, we created multiple vaccines that have a 95% efficacy, that appear to be extraordinarily well tolerated, that may very well change the game here. So for me, this, and again, I'm going to even go bigger here. I think this marks the beginning of a new phase of science, of medicine, of technology. A few years ago, kids wanted to work at Google, right? Kids wanted to work at Apple when they got out of college, or now they don't even go to college, right? They become apprentices. Google no longer requires a college education. But what do they do now? Well, maybe, and some people call it the Fauci effect. People want to go into medicine. And I think it's a wonderful opportunity for digital health companies and big pharma alike to recruit the best and the brightest to come to our industry to give it that second level of engagement. So for me, I think that's part of what COVID has launched. It's launched that inflection point in careers. People have said that this century is the century of science. It's the century of medicine. And we look at things like longevity. So for me, COVID has ignited the awareness that science is our partner in transforming humanity. And it's a profoundly important time for digital health, because activity trackers now need that. And CRISPR and genomic analysis and all these things that we talk about, kind of whimsically, are not just changing our lives, but are saving our lives.
Well, fantastic, John. I could talk to you for hours, easily. To round up, I would like to finish the show with a 1 minute of fame. Anything on personal achievement, family achievement, professional, a shout out to anyone, anything that you want to share with us.
Thank you. Thanks for the. Okay, here's the point. Okay, it's no longer about your IQ. It's no longer about your EQ, right? Smarts and empathy. It's about your TQ. It's about your technology quotient. Now, you need all three, and that's the secret formula to success today. You need a good IQ. You got to be smart. You need an empathic quotient, right? You need to respect individuals and be humanistic. But unless you adopt technology into your clinical practice, into your classroom, into your daily lives, you're not going to be as successful as you can be. So that's a book that I'm working on now. That's my new podcast. But technology quotient, TQ, is going to be an important arbiter of our success.
Wow. What a way to end. John, thank you so much for your time. Fascinating conversation.
Thank you.
What a way to start this series, the Digital Health and Wearable series. I'd like to thank all the viewers for tuning in. Make sure you share the series with everyone in healthcare. And John, finally, I wish you a very prosperous 2021, and hopefully we meet soon. Thank you.
And you too. See you soon. Bye-bye now.
See you soon. Thank you, John.